Anxiety and depression are both types of mood disorders. Depression can cause feelings of sadness, hopelessness, and reduced energy, while anxiety can create feelings of nervousness, worry, or dread. It's possible to have both conditions at the same time, and they can share symptoms like agitation and restlessness. It's normal to experience feelings of anxiety or depression occasionally, but if these feelings occur frequently and significantly impact your daily life, you may have a treatable disorder. Your doctor can use your symptoms to determine whether you have anxiety, depression, or both. Some treatments can work for both conditions. When you're feeling depressed, you might experience symptoms like feeling sad, hopeless, or anxious. Losing interest in things you used to enjoy. Having less energy. Eating more or less than usual. Sleeping too much or too little. Having trouble concentrating. To be diagnosed with depression, these symptoms need to be present most of the day, nearly every day, for at least 2 weeks. It's also important to rule out any medical causes, so your doctor may need to check for conditions like thyroid problems. It's normal to feel worried or fearful at times, but when these feelings become excessive and don't go away, it could be a sign of an anxiety disorder. Some signs that you may have anxiety include feeling overwhelmed by worry, being irritable or on edge, experiencing sweaty or shaky feelings, and feeling like you're out of control. Anxiety disorders come in different forms, each with its own set of symptoms. Generalized anxiety disorder, constant worry about many different things. Social anxiety disorder, excessive worry when around other people. Panic disorder, sudden feelings of fear, with symptoms like chest pain and a pounding heart. Phobias, intense fears of places or things, like closed spaces or animals. Obsessive-compulsive disorder, a pattern of thoughts or fears that cause repetitive behaviors. Post-traumatic stress disorder, PTSD usually occurs after a difficult or traumatic experience, can manifest as flashbacks, panic attacks, or anxious feelings triggered by memories of the event. Depression and anxiety have different symptoms. Depression is feeling sad all the time, having no energy, and losing interest in things you used to enjoy. Some people with depression even think about hurting themselves. Anxiety is about feeling afraid or worried all the time, and not being able to control it. Depending on the type of anxiety, you might feel worried during everyday activities like meeting new people. Both depression and anxiety are very common, and they often occur together. About 60% of people with anxiety also have symptoms of depression, and vice versa. Each condition can worsen the symptoms of the other and make them last longer. The same genes may be responsible for both conditions. Anxiety and depression could also result from the same structures or processes in the brain. Stress and trauma early in your life can trigger both depression and anxiety. If you have anxiety, you may be at a greater risk for depression. Experts say that avoiding the things you fear might lead to depression. It can be challenging for doctors to diagnose and treat depression and anxiety when they occur at the same time. That's why it's important to tell your doctor about all of your symptoms. Treatment for anxiety and depression usually involves talk therapy, medication, or a combination of both. Talk therapy, counseling. A professional therapist can create a plan to treat your anxiety, depression, or both. Some types of therapy that can help include cognitive behavioral therapy, CBT, which teaches you how to think and behave differently to stop triggering your anxiety or depression. Interpersonal therapy, which helps you learn how to communicate better. Problem-solving therapy, which gives you skills to manage your symptoms. You can find a therapist who specializes in these types of therapy through the Anxiety Disorders Association of America, or ask your doctor for a referral. Anxiety and depression medication. Your doctor can prescribe an antidepressant drug to treat both depression and anxiety symptoms, such as an SSRI, selective serotonin reuptake inhibitor, an SNRI, serotonin norepinephrine reuptake inhibitor, or others such as bupropion and mirtazapine. Some examples of SSRIs are citalopram, Celexa; escitalopram, Lexapro; fluoxetine, Prozac, Sarafem, Symbyax; fluvoxamine, Luvox; paroxetine, Paxil; sertraline, Zoloft; vilazodone, Vibrid; Some examples of SNRIs are desvenlafaxine, Cadezla, Pristic; duloxetine, Cymbalta; levomilnacipran, Fetsima; venlafaxine, Effexor. Examples of bupropion include Aplenzin, Wellbutrin, Wellbutrin SR, Wellbutrin XL. It may take a few weeks or months for your medicine to work. You might have to try a few kinds before you find one that's right for you. Other strategies. In addition to therapy and medication, you can also try the following to help manage your symptoms. Exercise, which is considered a treatment for mild to moderate depression. Relaxation techniques such as yoga, meditation, and breathing exercises. Checking your diet by consuming nutritious foods and limiting sugar, caffeine, alcohol, and processed foods. Seeking support from family, friends, support groups, or professional counselors. If you're experiencing thoughts of self-harm or suicide, reach out to trained counselors at the National Suicide and Crisis Lifeline at 988 for help and resources.